Hello, my name is Dr. Kalitenko, and today we are going to talk about bioidentical hormone replacement therapy. And today we are going to discuss the ways we usually administer bioidentical hormones. There are three major ways we use to administer bioidentical hormone replacement therapy. First is injections, second is pills, and third is creams. To be honest with you, the first way, the injections I don't like. And the reason for that is because when somebody is getting bioidentical hormone through injection, usually it's not good to maintain the same level of bioidentical hormones all the time. Because the highest level you have when you just immediately after the injection, after that, level starts declining and you feel it. You don't feel as good as before. That's why we try to avoid the injections. Unless injections is the only way we can give bioidentical hormones. The classic example is HCG. There is no way we can give it by pills or creams. It's a very powerful, very good hormone, and we like it, but there's only way to give it is by injections. But other than that, there are other ways, like pills and creams. Pills is a way to give hormones when we have a very specific action on that. Supposedly, a woman comes to me with the complaints of difficult falling asleep, and we find that she is deficient in progesterone. Then the most likely option is giving progesterone as a pill, and progesterone works as a natural sleeping pill. The reason for that is because as soon as progesterone is injected, it's metabolized in the liver in a way that some metabolites promote initiation of sleep, and that's what we want. But other than that, if we don't want that, the preferred way, of course, is creams. Why is cream? Why creams? That's because as soon as you put somebody on your skin, it's not going to go through liver, and the rate of metabolization is quite low. That's why we are quite sure that you get in the blood whatever we give you. And that's a very important thing, because as soon as you take it as a pill, you never know, because who knows how your liver is going to metabolize this particular hormone, because not everybody is clean of toxins, and as you know, the more toxins you have, the less probability that your liver is functioning properly. That's why to ensure the right concentration and the right amount of hormone, it's always better to administer as a cream. And it's quite easy. So what we do, we usually recommend to put a small amount of hormones on your wrists and rub it in like this. Okay. Why is that? Because there is no hair and it's quite easy to clean, and just make sure that your significant other is not going to get hormones you are taking. Supposedly, a man is taking testosterone, so obviously he doesn't want his beloved woman to have testosterone the same amount as he does, because he might transform her in a man, not a woman. But he needs a woman, he doesn't need a man next to him. And that's why obviously that you need to take precautions to make sure that when you rub your hormones in, you give you some time to absorb, but other than that, you need to clean the area after that in a few hours to make sure that when you touch somebody else, it's not going to be given to your kids or to your spouse or to anybody else. And that's pretty much it. So hormones are given most of the time in creams. That is very reliable, very good way in terms of easy dosing, because a patient actually can give himself or herself a certain amount of hormones according to his feelings. And that's very important, because someday we need more hormones, sometime someday we need less hormones, and that's why we can't take the same dose of hormones every day the same. And usually patients learn very quickly how to do that, and they just can put a little bit less, a little bit more hormones according to the station, and that's why they can achieve the effects they need. In my understanding, the most important thing is that basically this way puts patient in charge of his health. He's not going to be dependent on a drug. He's not a slave of pharmaceutical industry. No, he's the boss. he or she is the boss, and he is the one or she is the one who actually does it, who can determine how he will feel. He is in charge, he is the boss, and he is the one who actually in charge of his health. And that's, in my understanding, is very good. Thanks to Bioidentical Hormone Replacement Therapy. Thank you very much.